Future Smiles is a school-based program which uses public health dental hygienists. We go into at-risk schools that have a high percentage of children who are underserved, low income, they're on Medicaid, and they don't have the opportunity to go to a dental provider. So our program brings in portable dental equipment that's made by Dental Works, and we set up in a classroom and we accommodate the needs of the community that we serve in that school. You know, we started at one school-based health center that had a set dental chair. That was Cunningham Elementary, and that particular site had a medical provider, but they didn't have like a sterilizer and instruments and the other components for a preventive oral health program. So I brought all that in through grant writing and donations from some really wonderful sponsors. Our original grant came from Oral Health America. We're very grateful to them for both their grant award as well as their product donation. And from that point, today in 2012, we service 10 schools. And out of the 10 schools, we have 4 set sites, just like the Cunningham site. So we serve about 200 children a month, and next year our goal is to serve over 2,400 children in the Las Vegas area. We have a team of 10 public health dental hygienists who have a special endorsement from the Nevada State Board of Dental Examiners. That licensure is called a public health dental hygiene endorsement. And through that special license, they can provide care without the direct supervision of a dentist. We service the children. We have 12 schools that we are targeting for next year. Of those 12 schools, 10 of them are schools that we've been to before. And again, like I said, we have 4 set sites, which we call a school-based health center for education and prevention of oral disease. And our nickname is an EPOD. And the EPODs are always operating. The particular EPODs that we have here are Clark High School, Cunningham Elementary, Hollingsworth, and we are now currently at Whitney Elementary in their Village of Hope, which services homeless children. You know, for the most part, due to economic circumstances and different situations within the family dynamic, the children just are not able to go to the dentist. So when we see them, we take them into the program and they will receive preventive oral health care on a regular basis, which they wouldn't otherwise get. If they are in high need for dental services, we refer them to a partnering dentist. The dental school is wonderful and they service our children, as well as some of the private dental offices in town and Paradise Park Children's Clinic. And we monitor and track those children to ensure that they get the restorative treatment that they need and that they have this preventive piece so that they don't get back into a state of chronic oral disease. I track the stats for free and reduced lunch enrollment. Currently, Clark County has 56% of the children on free and reduced lunch enrollment, which is stating that over 50% of the children are living below federal poverty guidelines. So that to me is significant. We're just seeing that the families, they've lost jobs, they've lost insurance. So one of the first things that goes is alternate health care. And dentistry shouldn't be a luxury. It should be a piece that is part of your day-to-day life because you need good oral health to be healthy overall. So by going into the schools and breaking down the barriers of access, transportation, and affordability, we provide care for those really, really targeted, needy children. You know, one of the things that I'm most proud of is that first site at Cunningham Elementary. From when we started at our baseline in late 2009, 2010 to today, we see that the children went from 20% of the children we saw had dental sealants to 60%. Also, we also see a decrease in tooth decay. Untreated tooth decay at that site has decreased by 18%. So we're beginning to measure that this preventive piece, the referral mechanism, and being that oral health provider in that home for those children is really getting them to a state of health, and that's really exciting. So the new sites that we started servicing in 2011, we are hoping to see the same improvement in that population as well in 2 years. A public health program like Future Smiles actually provides care for children who would not be able to go to a dental office due to barriers such as transportation or financial restrictions within their family dynamics. So the sense of us competing with the dental community, it really isn't true, because what we do is we provide that triage, we get the child started into a dental professional role, and then we refer the child to the dental community and actually make an awareness and a positive want and desire for dentistry. So there's a companionship between dental hygiene and public health and the private sector, and I really think that's important. The other thing that Future Smiles has done is we are all credentialed Medicaid providers, and our program does get reimbursement for Medicaid services that we provide. What we're seeing is about 34% of our children that we see are on Medicaid, but 66% are still uninsured. So we're trying to help the families find resources so that they can become enrolled in the Medicaid system, which will open doors for not just oral health, but overall health care, medical, dental, mental health, and vision. It's really important to get families enrolled in the Medicaid system. You know, to help our program, we really survive on donations. So corporate companies that have toothbrushes, toothpaste, consumables, mask, glove, gauze, that is awesome because we can save our grant dollars for other needs and use those donated products, and we really appreciate that. That really helps. We have a link on our website, which is www.futuresmiles.net, and you can donate directly to us if you're looking for an oral health program that you'd like to help support. The other thing with our program is we have not been able to do digital x-ray imaging. We do have the Dentrix system and we are Medicaid providers, but we would really love a Nomad system to be able to do those digital images, to be able to share those with our dental partners, and then also share our case studies that we're seeing in the community. A picture speaks so much about what the oral health need is, and those x-rays would really help us. We have a wonderful website. I encourage everyone to check us out. It's www.futuresmiles.net. You can email us. You can find out what we got going on. Our calendar's there, our forms, and all kinds of information as far as what the program is doing. So please visit us.